Namaste friends, I myself Professor Dr. Shyam Sundar Kakani. Just I'm going to give you the introduction about the cardiology in Ayurveda. This course we are running here in level 1, level 2 and level 3 where we are discussing taking the detailed knowledge about the cardiology in Ayurveda. Exclusively here I am briefing you regarding the level 1, what will be the syllabus, what will be the course design. So in level 1 we are taking the advantage of the basic principles of the Ayurveda, and with the help of the basic principles we will definitely, the point number 1, the Sama and Niram Vichar, and I would like to make you familiar with Am Vataja Rudkapat Vikruti or rheumatic heart disease, how to treat by applying the Sama and Niram Vichar. I would like to make you familiar with the heartburn, Pittaja Rudrog, how to differentiate, mainly because in our day-to-day practice, number of the patients are coming with this complaint. You have to very carefully differentiate between the reflex esophagitis, acid peptic syndrome, and so on. And definitely I will add the line of treatment by applying the basic principle Upashaya Nupashaya Bhyam Vyadhim Parikshayat. So this is a number of the patients visiting to our consulting with the problem of Pitta Jarudrog, that is a very, you can say, a important vital topic to understand its clinical manifestation along with the line of treatment. Definitely I will take the advantage to make you familiar with the hyperlipidemia. This is also a very common sequelae in our day-to-day practice, and definitely I would like to put a light with the respect to the Dhatvagni Mandya. Nevertheless, the atherosclerotic heart disease, that is Margavarodhajanya Vata Prakop, or at the same time I would like to make you familiar with the term Damani Pratichay. The identity discussed by the Vagbhatacharya, that is the Kaphanubandhi Vata Jarudrog. All these terminologies I want to make you aware about in our day-to-day clinical practice, that is the atherosclerosis. Level 1 will put a light on the Vataja, Pittaja, Kaphaja, Sannipatik and Krumija Rudrog. In our day-to-day practice, how to understand the concept of the Krumija Rudrog. I will be happy to make you familiar with the terminology Rutshul, which Sushruta very broadly describe this term, and you all are aware about this terminology, the number of the patients visiting to your consulting room. Definitely how to manage this patient, what type of the drugs we will prefer, what type of the drugs we will select, how to select the drug, the doses and all these things will be briefly described in the level 1. You all are aware regarding the very little description of the Rudroga in Sanhitas described, but this is not true. With the commentary of the Chakrapani, commentary of the Jejjat, Dallan, Vijay Rakshit, and all the Sanhitas, Bruhatrayi and Lagutrayi, definitely in this level 1, we will take the deep and thorough knowledge about the terminology, and definitely you will be happy to know that the Rudrog and Ayurveda and its depth, along with its clinical presentation, will be in detail, will be described in the level 1, and you will be surprised that the acute myocardial infarction, Hridayabhighat, Hriday Avarodh, Hriday Ayam, Vyapathu, all these different terminologies mentioned to describe the Rudro with its clinical manifestation, because the last 32 years after my post graduation I am doing the same practice as an Ayurvedic cardiologist, and I would like to share my experience